Hi, I'm Elise Pulliam, registered dietitian. Today I want to focus on cholesterol because elevated cholesterol affects over 73 million Americans and can be deadly. So I'd like to review the risk factors associated with elevated cholesterol and review how to lower the risk, as well as provide you with tips on the elements of a low fat, heart healthy diet. So, what is cholesterol? Cholesterol is a waxy, fat like substance that's found in all of your cells. Your body needs some cholesterol to make hormones, to make vitamin D, and to make substance that helps you to digest foods. An important thing that I want to point out to you right now is that you see here that 25% of the cholesterol that's in your body comes from high cholesterol foods. And during this presentation, I'll review with you what the high cholesterol foods are. But what I want to focus on more is the fact that 75% of the cholesterol in your body is made by your body. Your body makes cholesterol in response to the amount of saturated fat that you eat. So, the more saturated fat that you eat, the more cholesterol your body makes. An easy way to remember which foods are the saturated foods would be just to know that saturated foods come from animal products. Um, so, the most effective way to reduce the amount of cholesterol in your body would be to limit the amount of saturated fat in your diet. And we're going to review exactly how to do that. There are two types of cholesterol that we are going to talk about. Uh, the first one would be the LDL, which is often referred to as the bad cholesterol. And then we have the HDLs, which are referred to as the good cholesterol. They both are a combination of fat or lipids and protein. Because your body or your bloodstream is water based, and we all know that water and fat does not mix. So, in order for your body to transport this fat through your bloodstream, it has to attach it to a protein in order for that to happen. So that's how you get the name low density lipoprotein or high density lipoprotein. So it's a combination of fat attached to a protein. So let's talk about the LDL type of cholesterol first. The LDL cholesterol is your low density lipoprotein. It has the bad reputation and is considered the bad cholesterol. The reason it's called the bad cholesterol is because it leaves plaque in the arteries when it travels through. If you could visualize, say, a ball of fat traveling through the artery with the LDL or the bad cholesterol, as it's traveling through the artery, is shedding pieces of fat or plaque in your arteries and it's collecting on the artery wall. If this happens enough, this plaque will build up and become too small of an opening for the blood to flow through, or completely close, which could cause a heart attack or a stroke. So, a reason why the LDLs are considered the bad cholesterol is because this could happen. It leaves behind plaque, and this plaque builds up on your artery walls. And if it happens, or if it closes or builds up enough, it could cause a heart attack or a stroke. So, you want to limit the amount of the LDLs that's in your bloodstream for that reason. The HDL, or the high density lipoprotein, has the opposite effect. If you look at the little green figures here, these are the good cholesterol. And as the good cholesterol moves through the bloodstream, it's actually attracting some of the bad particles, attaching with them and the uh, taking them out of the bloodstream and into the liver. So again, with the HDLs kind of clean up what the LDLs have left behind. So you want more HDLs in your bloodstream for this reason. This slide is just another illustration of the same thing. You see over here, the LDLs are the green little particles here as they travel through the bloodstream and through the arteries. They're leaving behind plaque deposits on your artery walls, which could clog up the arteries. The good cholesterol here does the opposite. As it's traveling through the arteries, it's actually picking up or cleaning up the particles left behind by the bad cholesterol and takes them out of the arteries and back to the liver. And that's exactly what you want and need to happen. The last type of fat that we're going to talk about would be the triglycerides. The triglycerides are the most common type of fat in the body. They store excess energy from your diet. So if you eat, too many calories, those extra calories are going to be stored as fat. A high triglyceride level combined with high LDLs or low HDL definitely will increase your risk of heart disease, heart attack, or stroke. So again, you want these two, the triglycerides and the LDLs, to be lower and for your HDLs to be higher to reduce your risk. So here's a quick pre-test just to check your knowledge. All right, our question is, young children are not at risk for high cholesterol. Is this true or false? Young children are not at risk for high cholesterol. This answer is false. Children are at risk for developing high cholesterol, especially if they have a family history of high cholesterol or a family history of early heart attack or early stroke. I fall into this category actually. As a teenager, my cholesterol was over 200, and we'll talk about exact numbers later, but my cholesterol was borderline high even as a child. So my entire life, I've had to monitor the cholesterol level and monitor my diet to make sure that I limit the risk as much as possible. So, again, the answer to this question is false. Children are at risk for developing high cholesterol. So, we talked earlier about the two ways that cholesterol enters your bloodstream. One is when you ingest foods that are high in cholesterol. And this slide talks about just that. Some foods are very, very high in cholesterol, and every day you want to make sure that you consume less than 200 milligrams of cholesterol. But if you look at the list of foods we have listed here, one egg yolk has over 200 milligrams of cholesterol. Some of the other foods are fatty meats, whole milk, and whole milk cheese. Shrimp, lobster, and crab are also high cholesterol foods. Now, I'm not saying that you should not eat any of these foods. I'm just I'm just saying that you want to be aware of which foods are high in cholesterol, and if your cholesterol is high, you want to limit these foods in your diet. So those foods that we just talked about are the foods that are high in cholesterol. But remember, only 25% of the cholesterol in your body comes from foods that are high in cholesterol. The majority of the cholesterol in your body comes from your body making too much cholesterol. And your body makes cholesterol in response to the amount of saturated fat that's in your diet. So, the big thing is to know which foods are saturated fat. And I mentioned earlier, saturated fat comes from animal products, but some animal products are higher in saturated fats than others. Some of your fatty meats are going to be real high in saturated fat. This would be like beef or pork ribs. Um, a lot of cuts of chicken will be lower in saturated fat, but cuts like the thigh or the skin of poultry will be high in saturated fat. Bacon and sausage are high in saturated fat. Also, whole milk, um, milk cream, solid margarines or butter. So, what you want to use instead of like the solid margarine or butter, you want to use the softer tub like margarine. Instead of using whole milk, you want to use skim milk or low fat milk. Instead of having maybe bacon or sausage for breakfast, you might want to try Canadian bacon. And again, instead of having the skin on your chicken or turkey, you want to just remove the skin, and that's going to help to um, eliminate some of the saturated fat. So, if you are following a heart healthy diet, you want to make sure that you limit the amount of fat in your diet to no more than 25 to 35% of the calories that you eat. Um, I thought it would be beneficial to just go over a sample menu of a diet that has 25 to 35% of, of fat. So, a typical breakfast would be, say, a half a cup of apple juice, three-fourths of a cup of oatmeal, a cup of low fat milk, and a banana for breakfast. You could also have coffee. A lower fat lunch would be 2 slices of whole wheat bread, 2 ounces of a lean deli turkey breast, 1 ounce of a low fat cheese like Swiss cheese. A lot of the white cheeses are lower fat. That sandwich should have lettuce and tomato, and then you could also have another cup of skim milk. A typical snack or a lower fat snack would be, say, 1 ounce of trail mix with a cup of blueberries. With that, a dinner could be 3 ounces of a broiled fish, a whole cup full of brown rice with a little bit of soft margarine on it. You could have broccoli and carrots with that, as well as a tossed salad with salad dressing. So there's lots of food that you can have. Um, just you want to be strategic and make sure that you're choosing some of the lower fat food items. One thing you also want to do to reduce your risk of elevated cholesterol is to eat more omega-3 fats. Um, walnuts are an excellent source of omega-3. They're great to snack on, great to add as a topping to various foods. Salmon, tuna, mackerel, sardines are all great sources of omega-3. Um, One thing I was just looking over this list, and I don't think I've had sardines since I was a child, but they are an excellent source of omega 3. So try to add some of these foods into your diet. Flax seeds also a good idea. And if you have to cook with oil, make sure that it's canola oil or soybean oil. Another thing you can do to reduce your risk of elevated cholesterol is to increase the fiber in your diet. Every day you should consume 20 to 30 grams of dietary fiber. Read your labels. Anytime you have bread, look at the label and make sure that it has fiber. If you have cereal, look at the label, make sure that it has fiber. All fruits and vegetables have a good amount of fiber. And again, with all whole grain products, read labels and make sure you're getting the 20 to 30 grams of fiber every single day. This is really going to help protect you against elevated cholesterol. Another thing to do here is to um, maintain a healthy weight. Um, if your weight is higher, or if your BMI is high, that's going to definitely put you at risk for developing high cholesterol. So with this chart here, you want to find your height here on this column here. Let's say I am 5'11". So find your height, move over to your weight, and then move all the way up to the top, and it will tell you what your BMI is. So find your height on the left-hand column here. Say if you're 5'5", follow this over. If you're 5'5", your ideal body weight's around 150. If you follow that up, you'll see that puts your BMI at 25. You want your BMI at 25 or below. Anything above 25 to 29 puts you in the overweight category, and anything over 30 is obese. So if you're 5'5", and let's go over past the 25. If you're 5'5" and weigh 162, that puts you at overweight. If you're 5'5" and let's go further over, if you're 5'5" and 180, you are obese and at definite risk for developing high cholesterol and heart disease. So set a goal to aim for a healthier weight. Another thing you can do is eat more plant-based meals. I would set a goal to try to have a meatless meal once a week would be a good start. For an example, yesterday for dinner, we had a baked potato and a salad. Aim to have a meatless meal at least once a week is a good idea. Another thing that will definitely help with your good cholesterol is exercise. Exercise is one of the big ways to increase your good cholesterol or your HDLs. Any kind of exercise would be ideal. Or you want a combination of different types of exercise. You want to do some strength training with weights, do some cardio, which would be walking, running, swimming, biking, any kind of cardio, and also good stretching weekly. You could do yoga, Pilates, or just stretching. Meditation's a good idea. These are all part of a healthy lifestyle. So make sure that you add in exercise on most days. You should also know your numbers. If you don't know your cholesterol level, ask your doctor to for your lab results. Your cholesterol level should be below 200. That's the desirable range. Between 200 and 239 is borderline high, and then over 240 is high risk. For your good cholesterol should be above 60. I mentioned to you earlier that genetically my cholesterol level has always been above 200. It's been in the borderline range my entire life. But the good thing is my HDL good cholesterol is like 75, you know, because I exercise most days. So I'm not on any kind of medication, or I don't need to be on any kind of medication because the ratio of my good cholesterol um, and the bad cholesterol, my good cholesterol is high. So uh, with the LDLs, you want to make sure that they remain below 100. And with your triglycerides should be less than 150. So it's important to know your numbers, ask your doctor for your results, and track it and know where you are with your cholesterol levels. So here's a quick post test. What is the target cholesterol level? Below 200, below 240, or below 300? All right, we just talked about this. Your target cholesterol level is below 200. And remember, borderline is right around between 200 and 239, right below 240. So know your numbers um, and make sure that you get yourself in a good range. All right, so in summary, some of the things that you want to avoid. You want to avoid unhealthy eating habits, such as eating lots of saturated fats. And we already talked about what the saturated fats are. These fats are found in red meats, uh, full fat dairy products, chocolate, some baked goods, and many deep fried or processed foods. Eating too much saturated fat can raise your bad cholesterol, your LDLs. Lack of physical activity, with lots of sitting and little exercise, this lowers your good cholesterol. Smoking will lower your good cholesterol, um, especially in women, and it can also increase your bad cholesterol. So you really want to stop smoking if you haven't already. Stress will raise certain types of hormone that will cause you to make more cholesterol. So try meditation. Exercise often helps stress. Drinking too much alcohol can increase your total cholesterol level. And lastly, we mentioned that being overweight or obese can also put you at higher risk. So you want to work towards a healthy diet. Well, all right, this concludes our class on cholesterol. I really hope that that you were able to find some information that you can use. And as always, keep in mind that small changes that you make today can make for a healthier tomorrow.